Hello, on the occasion of No Smoking Day, 10th of March, which falls on 10th of March this year, I'd like to tell you all a few facts and figures about smoking, why not, and what are the problems with it. I think we are all aware that smoking and the ill effects of tobacco is very well known amongst all of us. However, there are certain facts to be looked at. As you can see in the chart which is being shown, the amount of smoking that you do, the amount of cigarettes you consume per day over a period of years, just look at the amount of money that you have blown up or burnt away, as I can literally put it, and that is what one needs to realize. Again, it's not a question of just money, and smoking is usually related to cancer, but it is also related to various diseases. With smokers, you start getting the nicotine and the tobacco effects deposited in your blood vessels, leading to a much higher risk of cardiac illnesses, higher risk of vascular disorders, that is blood flow to the peripheral areas like your legs, and can lead to gangrene or dying of that foot, leading eventually to amputation. So one has to be careful of smoking. Unfortunately, smokers get into the habit at a very young age, not knowing what exactly is happening. And this is more due to the peers. Some senior person in your school or in early college is smoking. You think it's a very good effect of impressing a girl, or the girls even smokers, which unfortunately in India we are seeing a larger number today, trying to impress and be the in people with the crowd. And as a result of which, you get into the habit which gets very difficult to remove. So at the Asian Cancer of Institute, we regularly run these anti-tobacco programs. We also have a software program which we have developed in conjunction with a private party which is known as Hopscotch. And these monitor your smoking habits, guide you, counsel you, and tell you how to get rid of the tobacco habits. The other issues with tobacco and how it can be consumed besides smoking, of course, which is what the main issue is today, is some people chew tobacco, leading to cancers of the oral cavity, which is your jawbone, tongue, and the inside of your cheek. Or they tend to brush their teeth with tobacco, more so seen amongst the rural population, leading to tobacco related cancers of the jawbone. So to sum it up, I would say, if you see the picture that is being depicted, this is what tobacco will finally lead to. An 8th standard boy who did this painting after a lecture on tobacco, of how tobacco formed the thathadi, as we call it, that is the dead body on which it is carried, and this is what will eventually lead to. And remember, this is not a one-off event. Some people do tell me that they have slowed down their smoking or they've reduced their smoking. It's like saying that earlier I used to jump from the 5th floor of a building, but doctor, now I'm jumping from the 1st floor. Is that okay? Nothing is okay, believe me. Smoking, in short, is a very bad habit. Get rid of it as fast as you can, because that only will go a long way in saving your life, not only from death, but also the other ill effects which I have mentioned.